Hey, good morning, everyone. I'm Andrea from SCAN, and you are watching SCAN FYI. Hey, Mary Beth.
Good morning, Andrea. Hi, everyone. I'm Marybeth Kwatmuski. I'm the program coordinator here at SCAN. We're happy to have with us today Risheeta Joshi, who is a doctorate of physical therapy at CentraState. So good morning, Risheeta.
Good morning. Thank you so much.
Thank you so much for coming and being with us this morning. Our topic this morning is all about osteoporosis and some fall prevention. So before we kick that off, why don't you just tell us a little bit about yourself and your role at CentraState?
Sure. Well, my name is Risheeta. I'm a physical therapist here at the outpatient physical therapy at CentraState Medical Center. I've been here for about 4 years. I've been a physical therapist for almost 20 years now. And we have a great community here. It's a community-based hospital with a lot of specialty in physical therapy. So there's a lot of therapists, a lot of clinical specialists that have different passions that they are able to pursue here. And mine is osteoporosis and women's health. So it's been wonderful. It's very supported here, so it's nice.
Certainly at SCAN, we have done a lot. We've had a lot of conversation about osteoporosis and fall prevention. So this is a very good topic for us. But maybe why don't you first define what exactly do we mean when we say osteoporosis? How do you know when you have it? How do you find out?
Yes, absolutely. So osteoporosis, it's a musculoskeletal disorder that predisposes patients to fracture, risk of fracture or fracture risk. It's compromised bone strength. So when we talk about bone strength, we're not just talking about the bone density, but we're also talking about bone quality. So actually, how is the actual structural integrity of the bone? What's the architecture, the microarchitecture of the bone? What is the repetitive and accumulated use and wear and tear on the bone? And then that's how we talk about bone quality. Those two together, quality and density, come together and give us our bone strength. So it's really osteoporosis, which is so wonderful to talk about because it's a silent disease. People don't often know that they have osteoporosis until they end up with a fracture. Right. And depending on how brittle the bones are, patients can, they could sneeze and fracture. You can roll over in bed to grab a tissue and fracture. You could fall and fracture. When you fall from standing height and you fracture a bone, that right away just shouts osteoporosis and bone fragility. So when people fracture, it has a huge impact on their quality of life and their ability to maintain independence. So, that's where physical therapy comes in, but we would love to come in before that even happens, before fractures even happen, to let people know that you're at risk for osteoporosis. Not everyone has the same risk, but no one is immune from that.
So how do we find that out then? So it's all about detection.
Yes. So a couple of things. The doctors will, they can do risk assessments. The gold standard right now is the DEXA scan. It's like an X-ray, but has less radiation than that, and that looks at the bone density. So it's actually looking at the thickness of the bone, how dense the cells are together. So I actually have a picture. If I show you like normal bone and osteoporotic bone, so that's normal bone, and then you could see the structural difference in the osteoporotic bone. And I'm sorry, it's backwards, but just so you get that visual, so you can see, like, if that structural integrity is not there, it's going to collapse down. And that's what the DEXA scan will look at. But there's also risk factors. So there's different people have different risk factors. Overall, we can gain our bone mass, and peak bone mass comes by the time we're 28 to 30. Even 35, but we normally accumulate it by the time we're 18 to 20 years old. About 90 to 98% of our peak bone mass is accumulated. After that, we start to, our bones, the turnover is less and less, and so our bones can become more fragile. So different risk factors. If you're thin-boned, if you're female, depending on your hormonal status, ethnicity, your dietary choices, and also heredity. Heredity is up to 75% of the risk factors.
Wow.
And there's non-modifiable ones and also modifiable ones. So modifiable meaning your diet, your lifestyle, your level of activity and function, what kind of exercise do you do, what kind of diet do you have, are you smoking, do you drink alcohol, how much do you do that? All of those are risk factors that you can modify and we can control.
So like,
so you know, that's where physical therapy.
Like so many things that happen as we age, you actually do have a bit of control. Your lifestyle is definitely related to potentially having this.
Yes, and so a lot of times people think that osteoporosis is this old person's disease or old woman's disease. They think about that, you know, that dowager's hump or that kyphotic posture, that bent forward posture. But those postural changes are not, they don't happen because we age, they happen as we age. So it's not just because you're getting older that you're going to have that posture. You know, a lot of times I have another picture, and these are from Sarah Meeks. She's like the guru of physical therapy, and especially for osteoporosis. She's developed a lot of these exercises and treatment interventions. So if you start to think about how our posture changes, you know, a lot of times they think that this posture is like typical of an old person. But I have patients that are 80 and 90 years old with, you know, these postures that are much straighter. And nowadays you have kids coming in with posture like this because of electronics, and everything in our world is in front of us, you know, cooking, cleaning, our computers, we're reading, everything, we're always bent forward. So we lose that balance of and symmetry of our body to be able to hold us upright. And that's how we can help to prevent fractures, prevent falls, prevent osteoporosis from getting worse. Because if we can correct that asymmetry and get the balance back in our muscles, our joints, and we get our alignment back, then we're weight bearing correctly through our joints and through our bones. They'll maintain their normal strength and function.
Now, for folks who are older who do have a fracture, because obviously as an older person having any kind of a fracture, you know, potentially very serious and life altering. So do you want to talk a little bit about that?
Absolutely. So typically our risk increases as we age. So osteoporosis right now, the statistics show that it affects about 60% of people over the age of 60. Men and women. Wow. And that's really important to know, because it's not just an old woman's disease or something like that. Men and women. Now, men typically will have osteoporosis diagnosed later on in life, but men actually end up having more hip fractures than women. And hip fractures are particularly impactful on life and quality of life. But right now, if I just go back to osteoporosis and talk about almost 53 million in the people in the United States are at risk or already diagnosed with osteoporosis. It's more prevalent than coronary artery disease, heart attacks, and diabetes combined. It's more common than breast cancer, uterine cancer, and ovarian cancer combined. So it's prevalent, it's there, but it's silent. We can't see our bones unless you're actually getting screened and paying attention to that. Or you know your family member, your mom or your aunt or your dad had this posture, or that they fractured a bone. That's one of the risk factors. If you have a family member, immediate family member, mom, aunt, that kind of family relationship that's fractured a bone, you're at higher risk for fracturing a bone. And so then if we talk about women, 1 in 2 women over the age of 50 will fracture a bone. That's the statistics out there already. 2 million fractures in the United States, and this is data from 2010, cost over $18 billion for the healthcare system. So if you start to talk about, that's financial, but what about us? The primary consequence of osteoporosis is a fracture, and we want to prevent the first fracture, but the risk of a second fracture is a percentage increases, right? So a vertebral fracture of the spine, one person that gets, if you have a vertebral fracture, your risk of death is 2.7 times than anybody else who's never had a fracture. So having one vertebral fracture increases your risk of a second one 5-fold. So then you start to think about, as one fracture over the other, your body can't maintain its structural integrity. And so one fracture predisposes you to the next one, which increases your postural changes, which predisposes you to more fractures, which predisposes you to more fractures. Right. So it just spirals from there. It impacts your ability to breathe. It impacts your ability to function, to get up from a chair, walk across the room, to go to the bathroom, get your food. It impacts your ability to live independently. So for somebody who's had a hip fracture, it's the most disabling. 20 to 24% of people with a hip fracture pass away within 1 year after having a hip fracture.
If someone feels like they might be at risk, or you have a family member you're concerned about, what might be the next step to take to determine, where they are on the spectrum of osteoporosis?
Absolutely. So the first thing to do is to, you can read about it. And if you feel you're at risk, you have a conversation with your doctor. If you're already in physical therapy, you can have a conversation with your physical therapist. If you see a specialty doctor for orthopedics or rheumatology, talk to them about it. Start the conversation, because the doctors are the primary person to start the screening process. And if you have any of those risk factors, you start to add up those risk factors, your risk of a fracture is it starts to exponentially increase. So you just have a conversation with the doctor. They can order scans, the DEXA scan. There's screening questionnaires that they can do, and then talk about what your risk is, and then talk about treatment and prevention.
So Risheeta, if someone just wants to just but make sure that they're trying to keep an eye on this, is there any basic exercise that everyone should be doing, whether they're a candidate or not at this point?
Well, there are exercises to do, and I'm glad you asked that, because it has to be specific. The idea is that exercise is good for you. It is good for you. But if you have osteoporosis, you're at risk for osteoporosis, or you have any kind of injury that you're trying to prevent from getting worse, you have to do the right exercise, and it has to be safe for you to do it. So for patients with osteoporosis, at risk for osteoporosis, and some other diagnoses, bending forward and twisting movements increase your risk for a fracture. So you don't want to do those things, or you want to modify it. And you can modify anything. You can modify yoga, Pilates, gym exercises, aerobic exercises. You can participate in whatever activity you'd like to. It has to be safe. You have to know what not to do that's going to put you at risk for your fracture. Because like I said, somebody who has very fragile bones can sneeze and have a fracture. And the thing with the vertebral fractures is only 20 to 30% of them are actually symptomatic. What that means is only 20 to 30% of those people who fracture their bone actually feel it. Otherwise, it's silent, right? Sometimes people sneeze and they're like, oh, I felt something. And then they're like, oh, it'll just kind of work itself out. And later on, they'll have an x-ray, or they'll have a chest x-ray for something, and they'll be able to see
a fracture.
Yeah.
A fracture. Absolutely, absolutely. Which then contributes to their postural changes, which then contributes to increased risk of falls, decreased capacity for breathing, decreased, abdominal. A lot of people come in with a reflux or swallowing issues. They have problems with digestion, problems moving their bowels. All of these things can be contributed or attributed to postural changes. As you get more and more forward, what happens is you start compressing your visceral organs, right? So your lungs don't function properly. They can't expand. Your diaphragm can't move the way it's supposed to. Your stomach can't digest the way it's supposed to. Your intestines don't move the way they're supposed to. So not just changing, but changing your posture, getting things aligned. You breathe better, all your tubes start to line up, your esophagus, your trachea, your lungs can expand. That's all part of it. Your balance changes. When you're forward, your ability to know where you are in space, right? So if you're forward, I'll just turn sideways like this, your eyes still have to look up so you can see where you're going, right? We can't just look at the floor. But that changes the compression at the back of the neck. So then people have headaches, neck pain. And then when you start to change it, your balance actually changes, because now your head and shoulders are over your feet where your balance should be versus your head far forward of your feet, putting you outside of your base of support and your ability to maintain your balance.
Oh,
As I'm sitting up straighter in my chair.
I know we all did that. We all did that. As soon as you say posture, it's so simple, but it's hard to do. I could tell
You have to be
anybody all day long.
You have to be conscious and mindful of it. Yes.
right.
Exactly.
Like
And then you
like
have to have this
everything.
strength. Yeah,
Yeah.
then you have to have the strength in those postural muscles. It's not so easy to just say sit up, because we have multiple layers of muscle that contribute to our posture. And you talk about core exercises and people just think abdominal or deep abdominal exercises, sit-ups and that, but your core is your whole trunk, front, back, top, bottom, right? Your abdominal muscles, your deep abdominal muscles, absolutely. But all your erector spinae muscles, the muscles that run up and down your back that hold you up all day long, your respiratory muscles, your lungs, your diaphragm, and then your pelvic floor muscles. They create that core strength so that you can function and have live your life however you'd like to.
Well, here's an interesting question, because here we are, Mary Beth and I included, so many people working from home. Here we are at our computers. I make a point to keep getting up because I just can't sit like this. But do you have any suggestions for people like us who are working at home, probably sitting at their computer for way too long? What do we need to be doing to take
Exactly
better
what
care?
you said. Yeah, absolutely. Make sure that your setup of your equipment, your computer's right in front of you. When you're sitting, that your feet can touch the floor. If you need to, you have back support. You're all the way at the back. That there's a lumbar support supporting your spine, so that our bodies were not made to sit for the periods of time that we're sitting for, especially now. So really, every 20 to 30 minutes, you want to get up, walk to the bathroom, walk to get something to drink, stretch, and really realign yourself. So we're so used to being forward, we get stuck there. Then when you stand up, you're still stuck there, right? And we start to actually get our muscles start to tighten up in such a way that when we stand up, we're still kind of in the shape of a chair. We're still sitting. Our hips tighten up, our knees are tight, our chest and shoulders and our head are all kind of conform to whatever structure we were sitting in. And if you're sitting in a firm chair and your feet are on the ground, you can actually press your feet in the ground and activate the muscles so that we're not hanging on our bones. Our muscles that are supposed to be working are working, and they're holding us up, versus the joints and structures that shouldn't be holding us up are able to rest and relax. And that becomes part of that habitual way we move, right? If we're always stuck forward, we stand up and we move forward, and then we go to exercise and we're still stuck forward. We're just starting to accumulate all this added stress on our bodies. And then we wonder, then one day it's kind of like the last straw. And we're like, where did this come from? But it's the accumulation of,
right, of course. It didn't just happen this week. Yeah.
No. Though sometimes it feels that way, and just like all of a sudden, but it's the accumulation. So, and it's hard to know that for yourself. It's hard to know where to intervene and correct that for yourself. That's why coming to physical therapy or seeking out advice from somebody that knows, even if it's not osteoporosis, but just about body mechanics, body alignment, the stressors on the body, and how to undo that is important. So really getting up and walking, but when you get up, making sure that you're stretching to your ultimate height, your best posture, standing like you're 2 inches taller than you think you are. Sarah Meeks will always say that. Stand like you're 2 inches taller than you think you are. For me, it's like 3 or 4. I always wanted to be a little bit taller. So it's like that, really consciously think about it. And then when you're sitting, consciously think about how you're sitting and positioning everything.
Now, do you want to just give a brief overview? We're getting short on time. Give us a brief overview of the Posture for Life program at CentraState. And by the way, just to remind everyone who's listening, we'll put all the contact info in the comments, so you don't have to worry about that.
Yeah, so the Posture for Life program was developed as a bone health initiative to really help prevent fractures from happening and to treat osteoporosis and prevent osteoporosis from worsening. So it, as a department, with the support of our department, we were able to develop this program to initially address, postural changes that happen, fractures, prevent fractures from happening, because patients are coming into the ER with a hip fracture or vertebral fracture or a fall, and then the fractures are treated, but that underlying osteoporosis isn't in the mindset, right? So you want to get that out there right away. Osteoporosis, you're fractured because of osteoporosis. Let's treat it. Let's treat it like a heart attack. When you have a heart attack, you don't leave from the hospital unless you have the medication and the follow-up to do it. So that's part of our role. In physical therapy, that Posture for Life program is that. It's the intervention for physical therapy. You come in and you get an evaluation specific to you. What's your posture? What are your postural changes? Muscle weakness, muscle flexibility restrictions, balance restrictions. So we do that full eval, and then we develop a program. So then the program is specific exercises, site-specific exercises taken from the Meeks method of physical therapy treatment. They're safe exercises. They're effective. We know they work. People have come back and told me they've gained height, their bone density has changed, their quality of life has improved, their balance has improved. They're able to participate, in family events and their whatever recreational activities they want to do. People who still want to work out in the gym can do it. People who want to do yoga and Pilates, they can do it. But these exercises are the basic exercises that you'll do forever and ever and ever to maintain and prevent your posture from getting worse, to strengthen the muscles that actually affect your postural alignment so that you can have a good quality of life.
All right. And this is a program called Posture for Life, and it's available at CentraState. Again, why don't you just give your phone number, but we'll put it in the links anyway.
Sure. So the contact number for the physical therapy department is 732-294-2700. And then you just mentioned that you want to participate in the Posture for Life program, and they'll get you set up with the right therapist. We have a lot of therapists that have taken this education, and not just in osteoporosis, but also scoliosis, pelvic floor, women's health, the whole gamut. So there's a lot of specialty involved.
So I think that if you're listening today, that one thing you're going to learn is that while heredity may be a factor, that there are lifestyle changes that you can make over time that will definitely improve your physical situation, which will of course improve your mental situation, right?
All of it, your whole quality of life.
Absolutely. All right. Well, thank you, Risheeta Joshi, physical therapist from CentraState. Thank you for being with us today. And remember, everyone, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI.
Have a good day, everyone.
Bye, Marybeth.
Thank you. Have a good day. Thank you so much.